My name is Onesmus Mlewa Kalama. I work for IENASO, which is a regional organization based in Arusha, Tanzania. IENASO coordinates community action and supports communities to engage in national and global fund processes. For this reason, we developed a community-led monitoring guide to provide a framework for civil society organizations to be able to embed and develop community-led monitoring systems to inform, to generate information that will be used to inform programming as well as advocacy for decision-making at both national and regional levels. This community-led monitoring guide is going to provide a framework upon which civil society organizations and community groups will be able to implement community-led monitoring systems to generate credible information that they can actually be able to use to inform their programs, to hold leaders into accountable, as well as ensuring that they have information that they can use for advocacy in decision-making process.
My name is Tambazai Magwenzi, the Her Voice Fund Ambassador for Zimbabwe. Why is it key that communities should gather information? I believe that information is power, and communities should gather information because there is the strengthening of data advocacy-driven work. Results and analysis of information can impact positive changes in communities. Communities should gather information in a systematic monitoring model which ensures that there is the elimination of stigma and discrimination, but this would enable a culture of collective problem solving amongst decision makers, healthcare workers, policymakers in health, and also the recipients of care in HIV services.
My name is Aaron Sunday. I'm the Executive Director of African Network of Adolescents and Young Person Development, and I base in Nigeria. Why committee should be at the center of committee-led monitoring is due to the following few reasons. One, it could help in terms of improving quality of care for the committee members. Secondly, it will help us in terms of generating evidence, data that can be used in terms of advocacy. Thirdly, it could help in generating meaningful data that can be used in terms of designing programs and intervention. Fourthly, it's going to help us in terms of accountability, both from the health sector perspective and also from the government perspective to ensure services are delivered to the minimum standard.
I am Martha Clara Nakato, and I work with Uganda Network of Young People Living with HIV, UNIPA. Community-led monitoring gives the community the power to take part in influencing the strengthening of robust and effective health systems that we want. It is important to note that community data does drive the implementation of strategies for improved HIV/AIDS related SRIH, but also importantly, healthcare service provision. And that is why community-led monitoring remains very, very important for the communities.
We wish to thank our partners who supported the development of this guide in various forms, GIZ, Backup, and Frontline Aid, for their support in technical and financial support. We also would wish to thank the Stop PV Partnership, the Global Fund Community Rights and Gender Strategic Initiative Department, for having provided their technical support in the review of this guideline. We would wish to also send our thankful recommendations to all community members who are involved in providing essential content for the development of these guidelines. We also would wish to thank our consultant, Rhoda Lewa, who pulled all the information together to have this useful guide today, and many other partners that I am not mentioning here today. You are all gratefully thanked for having spent your time to actually contribute in one way or the other to making this guide the way it is today. As we launch this guide today, we wish to welcome all communities to be able to make use of this useful resource. Use this guide to shape your community-led monitoring systems so that it can inform your programs that are going to change the lives of communities.